Well, it's the only state in the nation that has universal health care coverage. So why, in hundreds of speeches since taking office, has President Obama not mentioned Massachusetts as an example of his desire for universal care?
Well, Michael Graham is a radio talk show host, and he joins us live from Boston this morning. Michael, always great to see you.
Great to see you, but I was really counting on tacking to Allison, so I'm kind of disappointed, I'll be honest.
Every time,
No
Michael.
dice.
Sorry to disappoint, my friend.
No, it's a human resources issue, Michael. We can't have you talking to her.
I understand.
Look,
I got those legal
We got that in
papers. I'm
full
fine.
effect. Michael, let's talk about this universal health care coverage that you guys have up there in Massachusetts. And, you know, it's interesting. Dave and I were just chatting here. You know, Mitt Romney never talks about it either. President Obama doesn't talk about it, yet it's right here in the United States. The reason they're not talking about it, is it because they're different than what we're going right now through with ObamaCare, or are they the exact same thing?
They're not talking about it because, to use a medical term, it sucks. That's why they're talking about it, because our premiums are the highest in the country, because our costs are going up faster than anybody, because the cost to the state, you know, what we as taxpayers have to pay, is up now to $912 million for ObamaCare. Remember, it's basically the same plan. You have a mandate. Everybody has to have insurance. If you don't have it, you have to pay a tax. The insurers have to take you no matter what your pre-existing conditions are, and that's what we're stuck with. This morning's Boston Globe front page news story. We're looking at premium rate hikes of 8 to 32% in 1 year. In fact, our average premium hike has been about 25% since the thing took effect. It's just killer. It's an absolute killer.
So why aren't the Republicans pointing to this as an example of what could happen in this country? Is that because it might be their own presidential candidate in 2012?
No doubt about it. The fact that Mitt Romney, with the 90% Democratic legislature up here, pushed it through makes people feel ambivalent. But remember, there are only about 7 Republicans in Massachusetts, Scott Brown being one of them, obviously, and Scott Brown voted for Romney Care. The idea was everybody gets covered, but somehow that's going to drive down prices. That's what President Obama keeps promising us. But no one ever explained, how does having more customers lower prices? There's also the scam part. You're a young, healthy guy, you're 30, the government says, you got to get insurance or we're going to charge you $750 in a tax. You figure, well, my insurance will be $400 or $500 a month. I'll just pay the tax and probably won't get sick anyway. But when they do get sick, because we require that you have to cover, you know, pre-existing conditions, you can't be turned away, they just show up. And so Harvard Pilgrim, for example, has found that they had a surge of people who sign up for insurance, keep it for 3 or 4 months, use thousands of dollars of services, then just drop it again and go back to paying the tax. Who gets stuck paying for those thousands of dollars? Their fellow insured and us taxpayers in Massachusetts. We all know Obamacare won't work. We're watching it not work right now, and yet we're going to still shove this down the American people's throat with a pure partisan vote.
Well, fascinating piece you've written, Michael Graham. We appreciate it. Check out Michael Graham's piece on this, and he's perhaps the only one. In the Boston Herald. He's perhaps the only one talking about this morning. Michael, we're going to go and hang out with Allison, but we got to